name's Amber Maynard. I'm a student at the College of Nursing at the University of Texas in Arlington. We're going to talk about using role play with therapeutic communication with students. Before doing role play with the students, we would kind of talk about therapeutic communication. So quickly, let's talk about this. What is therapeutic communication? How do you use this on a daily basis? The National Commission on Correctional Healthcare had a really good definition for therapeutic communication. It's defined as your face-to-face process of interacting and focuses on advancing the physical and emotional well-being of a patient. Communicating effectively with your patients is vital in good healthcare. So first off, let's review what bad therapeutic communication is. Asking personal questions, giving your personal opinion, changing the subject, giving false reassurance, asking them to explain certain things, approval or disapproval, and arguing. Good therapeutic communication, active listening. You need to be attentive to your patient and what they have to say to you. Make sure your verbal and nonverbal cues are in tune on the patient. So you need to sit facing the client with an open posture, lean in towards the client, maintain a good eye contact, and just relax. Sometimes the relaxing part for nursing students or new nurses is the hardest part. So a couple of more things with a good therapeutic communication. Share your observations. Share hope with them. Maybe make a joke or laugh about something with them. Sometimes that lightens the anxiety. The patient's already going to be very anxious, so that kind of may ease them. And share your feelings. One major component of good therapeutic communication is touch. This sometimes just holding their hand while you're maintaining that contact allows them to feel and experience that you are actually listening to them and truly care about them. Silence. Sometimes silence is the best thing. You're allowed to sit and sort out your feelings, think of what to say, think about what's going on, but you need to allow the patient to break that silence. Keep the patient up to date on the information. Let them know what's going on. Be like, hey, your lab tests take 30 to 45 minutes to complete. Once the doctor gets all those back, he'll be in and he'll talk to you. Or, hey, the doctor ordered an ultrasound and it takes 30 minutes, 45 minutes to get those results back. Or, hey, you're drinking that oral contrast right there. You have to drink it now, 1 in 45 minutes, and then they can get you an hour later. And then, even after you complete the test, it'll still be another 45 minutes. Let them know. They understand that we're busy, but they need to be kept in the know. So clarify with the patient if there's questions. Use paraphrasing and summarizing. So with summarizing, you pull everything together. This allows you to document better and allows the patient to know that you actually understand what's going on. And sometimes you need to use a little bit of self-disclosure, share your personal experiences, just make sure that it's related to what's going on. So with the role play with the nursing students, I would have a person acting as the patient, and we would have them sitting right here. We would kind of have them a little script to go through and allow a nursing student to communicate with them, and then that way that they kind of get the sense of what's going on. Gives them the impression from the patient side and the nurse side. So we would have a student come in and sit down to talk to their patient. So we'd sit here and we would talk to them, tell them what's going on, ask them if they need anything, discuss what's going on, the time frame, and all. So Therapeutic communication should be used daily in the healthcare field. This increases the confidence of your nurse by making them more comfortable with interacting with the patient. This also increases your patient satisfaction. If you keep that patient in the know of what's going on, your patient's going to be happier. They're not going to be standing out the door looking at you going, hey, what's going on? What are we waiting on? Are we waiting on the doctor? Are we waiting on this? I've even had to use the fact that I have to go in and tell my patients, hey, my doctor just got pulled into an emergency procedure. They'll be back in shortly, so it's going to be a little while before they get back. And they're always happy. They just want to know. Keep them in the know. So effective nurse communication provides optimal patient-centered care. So with therapeutic communication, just make sure that you have the open posture, you maintain eye contact, and just relax and talk to your patients. Listen to them. Make sure you have active listening.